When we began supporting the youth in antimicrobial resistance interventions almost 5 years ago, there was really little and no effort ongoing in the African continent. It was difficult at first, but through time, we developed innovative approaches to engage young people by empowering, appreciating their input, respecting their work, and giving them a seat at the table during decision making. Currently, we are happy that the movement has grown significantly. We now have multiple youth-led organizations across the continent focusing on antimicrobial resistance mitigation, and ReAct Africa continues to offer support to all these youth-led initiatives across different countries in the African region, both in the Anglophone region and also the Francophone region of Africa.
Most of the work that we do at AAA is basically youth-centered, youth-based, and one of which was one done in 2022. That was the Youth Against Antimicrobial Misuse initiative. So what we did was we designed an infographic that simplified what AMR was, how to prevent it, just simplified information in English, and then we translated them into over 80 languages in low and middle income countries. So these translated infographics were then used for physical sensitization, online sensitization.
We started with engaging primary school students through the WASH program, teaching them about the small issues about AMR, how to prevent and everything as such. We then went to high schools, where we taught, not high school, to universities and tertiary institutions, how we taught them about AMR, how we can prevent it. Then later, we decided to start programs like the one we partnered with ReAct Africa on AMLEP, and we designed a course, 6-month course, for the entire African youth in the tertiary institutions. Then from there, we came to our groundbreaking project, the one that it's the Ambassadors Program, where we took youth from tertiary institutions, not only in medical field, but also doing other disciplines, other programs away from medical field. For example, engineering, IT, business, and others.
Norman Atland was founded in the year 2017. I was a second year back then. So since then, we've always used arts, including performed arts, drama and skits, film, also graphics, photography, to address AMR and other health issues. And ReAct Africa has been part of my journey. Since 2020, they've always supported our work. When we have our functions, our anniversaries, when we are doing projects, they've always come through financially and also with materials, matters AMR, so that we can refer to them and make a relevant content.
Creation of awareness and educational campaigns. So we do that mainly through webinars and forums and occasionally workshops involving the students. We also engage the community actively on matters concerning AMR. And also during the WOW week, we mostly create awareness through the walks, the campaigns. We also utilize social media greatly.
We have advocated on AMR interventions at national, regional and global level. We have spearheaded advocacy efforts in AMR, in patient safety, in quality improvement, but also we've worked on projects that help support the development of national action plans in Nigeria. We also have our Youth Against Antimicrobial Misuse project, where we have an internship mentorship program dedicated to empowering young individuals in Africa to make them the next public health leaders that take up the fight of antimicrobial resistance. This program is aligned with the Kofi Annan Global Health Leadership Fellowship Program, where fellows from this fellowship come and educate, share experiences with the fellow interns.
So our major work is working with the public. We engage and empower the community in terms of antimicrobial resistance, whereby we train the school children. Also, we train the journalists and the public drivers and every group, farmers and healthcare providers.
AfroHoon has also supported in WOW Week whereby we go and present and showcase our research that we've been doing in AMR and also create awareness. We also as students participating walks, that is the AMR walk.
EDF is responding to the AMR issue from the environmental aspect, where we are at the forefront of fighting climate change, because we know climate change, extreme weather conditions such as flooding and drought that affects water, sanitation and hygiene, which also affects AMR. When people don't have access to water and they do not have access to adequate hygiene levels, there is a lot of communicable diseases in the settings, making people have the need to use antimicrobials, and then the use most of the time is not as it is recommended, leading to AMR. We also promote vaccination because we know prevention is key. We are also addressing the upcoming health challenges such as COVID-19.
But we have many challenges in this fight that we are facing. We have challenges of lack of resources, we have challenges a lack of technical support, we have challenges of lack of the support of some governments, some partners, some institutions.
We have also had the annual symposiums that we have in our different member organizations. Through those symposiums, we always ensure that we incorporate workshops or sessions or abstracts presentations on antimicrobial resistance. What have the pharmacy students been doing? What have other healthcare professionals been doing, and how can we improve from there?
We bring together so many medical students across Africa to combat AMR through bringing forward AMR courses where they can learn about AMR stewardship and prepare to be better health professionals in the future. We'd like ReAct to support us in this way. We want ReAct to help us with mentorship, help us with funding and partnership, because as FAMSA we cannot do this alone. We need ReAct to help us with capacity building sessions that can train the leaders that can lead different AMR.
In terms of support, I would say resource mobilization is a very important part, and also helping in standardizing the efforts of youth to meet the global requirements in terms of tackling AMR. We have to make sure that our roles as youth also synergizes with what the global stakeholders are trying to address. So we need to make sure that synchrony of effort and partnership with the stakeholders can be available for us to get things done properly, particularly here in the global south and in Africa.
One of the support that as Youth Led Initiative we need is incorporation in the National Action Plan policy development and also implementation of the National Action Plan. If we do have youths in this policy development and actualization of the policies, it will be way easier for us to be able to share the same vision and be able to achieve this objective with the National Action Plan.
We actually cry for voices to be heard in various political corridors and also in spaces that can bring up changes. For example, we need representation from various high-level meetings so that we can actually contribute our thinking towards the various agendas that have been brought up by the various discussion platforms in various organizations. So those are the areas that we need support and also attention.